Okay, so hello, my name is Jean Kim, and I will be talking about pain relief for chronic non-specific low back pain with electroacupuncture. I was interested in this topic because my previous experience includes working in an outpatient orthopedic clinic, and I have observed and shadowed other various PTs in outpatient clinics, hospitals, and skilled nursing facilities in Las Vegas during my undergrad at UNLV. And I have seen a lot of patients with low back pain due to various causes. One of the treatment methods some PT, OTs, and some doctors have used were e-stim units with other various therapeutic modalities depending on the diagnosis. So I believe that the marriage of acupuncture and electrical stimulation units will elegantly benefit each other, as well as its purpose and its abilities to increase the pain threshold and help provide the body in its self-healing process through these stimulations. So first, chronic low back pain is pain lasting for at least 3 months. Low back pain is the most common musculoskeletal condition affecting the adult population with a prevalence of up to 84%. From the Journal of Spinal Disease and Research, it stated that chronic low back pain represents the second leading cause of disability worldwide, being a major welfare and economic problem. From the Journal on Mechanism of Lower Back Pain, a guide for diagnosis and therapy, it stated the prevalence of chronic low back pain in adults has increased more than 100% in the last decade and continues to increase dramatically in the aging population, affecting both men and women in all ethnic groups, with a significant impact on functional capacity and occupational activities. It can also be influenced by psychological factors such as stress, depression, and/or anxiety. Given this complexity, the diagnostic evaluation of patients with chronic low back pain can be very challenging and requires complex clinical decision-making. Low back pain symptoms can derive from many potential anatomic sources, such as nerve roots, muscle, fascial structures, bones, joints, intervertebral discs, and organs within the abdominal cavity. Moreover, symptoms can also seed from abnormal neurological pain processing, causing neuropathic low back pain. The diagnostic evaluation of patients with low back pain can be very challenging and requires complex clinical decision-making. This information provided by the Jacksonville Orthopedic Institute. The lower back muscle anatomy includes the multifidus muscle, longissimus, spinalis, quadratus lumborum. The muscles of the low back work together with the transverse abdominal muscles to increase the intra-abdominal pressure. The muscles of the pelvic floor also help to increase this pressure, which provides stability to the spine and trunk. Common hip and back pain causes include injury to muscles from overuse, disc injury or degeneration, or spinal stenosis. Muscle injuries of the low back are commonly caused by improper lifting while twisting, a sudden movement, a fall, improper posture, which may cause low back pain, and many other structural sources in the lumbar spine. The multifidus muscle is also known as the local stabilizer muscle. It keeps the back straight and stable. Physiopedia.com, a nonprofit provider of physiotherapy knowledge, stated that the multifidus muscle has an important role in the static and dynamic spinal stability, and weakness in the multifidus muscle is associated with low back pain. Multifidus issues usually lead to other problems due to improper recruitment of other muscles to avoid pain. So sacrificing stability over mobility could be another factor or cause to the weakness in the multifidus muscle. In the Handbook of Oriental Medicine, it relates the kidney patterns to the lumbar region. Written on Remedy Health Media Spine Universe on TCM and back pain, it stated that the low back is most closely related, but not limited to, the health of the kidney meridian or channel system. Written by Dr. Cohen of Innate Chiropractic and Wellness Studio, In an acupuncturist's perspective, if the qi and or blood stagnate in the channels, specifically to the region of the low back, there will be pain. Qi is essentially the energy that circulates throughout your body. Qi travels through all 12 meridian channels in your body, very much like how blood travels through vessels. Traditional Oriental medicine method is to ensure that qi is able to move freely, that it is moving in the correct direction, just like safeguarding your body's homeostasis. So if qi does not move freely through your meridian channels, pain can develop. So what is acupuncture? Acupuncture is an intervention consisting of the insertion of needles at specific acupuncture points. In the Journal of Medical Acupuncture titled Acupoints Initiate the Healing Process, it stated when acupuncture needles are inserted into the human body, the needles may go through multiple layers, including the epidermis and dermis, subcutaneous tissue, and muscles. Each of these layers contains special structures and cells that may respond to needling. There are three kinds of reactions to acupuncture: a neuronal reaction, a biophysical reaction, and a biochemical reaction. Through neuronal reaction, when a needle is inserted and manipulated either manually or electronically, the local free nerve endings and specialized neural receptors receive the stimulation that is then transformed into nerve impulses. This nerve impulse could signal the brain in the pituitary gland and release neuronal hormones such as beta endorphins that actually increases the pain threshold. Through biophysical reaction, the common mechanism proposed for the effect of acupuncture needling is mechanical signaling through connective tissue, using the needling effect of rotation to produce connective tissue deformation as the model of mechanical signal transduction, where cells convert mechanical stimulus into electrochemical activity, which can benefit skeletal muscle growth and adaptation. So from the book, Neural Substrates of Acupuncture from Peripheral to Central Nervous System, it stated that twisting or rotation of the acupuncture needle creates winding of the connective tissue around the needle and deformation of collagen fibers, which initiates mechanical signals transmitted via the whole body's fascia network, the layer of connective tissue surrounding muscles, organs, and blood vessels. Research groups have proposed that the connective tissue may mediate the effects of manual acupuncture through a number of pathways. So transmission of a mechanical signal from the needle to nearby sensory afferent nerves, potential signaling within connective tissue fibroblasts with local effects on sensory nerves, and direct effect on connective tissue pathology, possibly involving reduction in inflammation and or fibrosis. In the biochemical reaction, needling produces micro tissue injury. I've heard some professors call it microtrauma. That injury initiates a healing process. Needling stimulation greatly increases the concentration of many neural and non-neural bioactive factors, such as noradrenaline, beta endorphin, acetylcholine, somatostatin, ATP, adenosine, and GABA. In the 4th edition book in Therapeutics, Modalities, and Rehabilitation, it stated clinically, clinicians use electrical currents to produce either muscle contraction or modification of pain impulses through effects on motor and sensory nerves. Electricity is a form of energy that can affect chemical and thermal changes on tissue. Electrical stimulating currents affect nerve and muscle tissues in various ways, based on the action of electricity on tissue. So electroacupuncture is a form of acupuncture where a small electric device is passed between pairs of acupuncture needles. So I use 10-7000. I don't know if you can see it. I purchased this on Amazon.com. It comes in a box and it comes with 4 electrodes. So this is an electrode. This is 2 electrodes. and 2 lead wires. So this is 1 lead wire. I separately purchased the alligator clips on tenspro.com, these right here, so that it could properly fit the lead connector socket. So it goes in here like this. So my TENS unit 7000 is also known as a asymmetric biphasic current, which is found in most portable TENS unit, which basically means the electric current is bidirectional. The currents are constantly going from changing from the negative to the positive pole. If this was a monophasic current device, the electric current would go towards the positive pole. So with the red one, usually clinicians used it to put it near the target site. So proximal to the target site is the positive pole, and distal to the target site is the negative electrode or alligator clip. So when connecting it to the acupuncture needle, this is a standard 1-2 acupuncture needle, which basically means that in length it is 25 millimeters, and in diameter it's 0.3 millimeters. There are different parts to the acupuncture needle. This end is the tail, the handle, the root, the body, and inside would be the tip. It's recommended for the alligator clip to clip near the root and handle, like that. In this PowerPoint, I just wanted to show you the figure that the top one is a monophasic current and the bottom one is that asymmetric biphasic current. To turn on the intensity dial, we want to move it clockwise, which are next to the lead connector sockets. The intensity dial is measured in milliamps, and the intensity of a constant voltage is measured in volts. So increasing the intensity of the electrical stimulus causes the current to reach much deeper into the tissue. On the bottom left, it will provide the 2 numbers, which is the width and rate number. The pulse width is also known as pulse duration. It is measured in microseconds. Typically, the higher the pulse width, the stimulation feels stronger. So if you set it high enough, that it will provide a muscle contraction. A lower pulse width is capable of stimulating different groups of nerve fibers and releasing neural hormones. So pulse duration, or also known as pulse width, is the recommended between 75 and 150 milliseconds. Unless I want to use it on people with chronic low back pain due to muscle atrophy or denervated muscles, I would increase the pulse duration for that contraction, for that muscle re-education, and increase in that range of motion. So also on the bottom left is the pulse rate number. It's also known as pulses per second. It is measured by frequency in hertz. It is the number of times a pulse occurs in 1 second. Low frequency stimulations are typically used to relieve chronic pain, while high frequencies are used for acute pain. Generally, for chronic pain, TENS unit are set between 2 and 10 hertz, moderate pain 35 to 50, and acute pain between 80 and 120 hertz. Chronic pain usually uses low frequency on low pulse width because the low frequency causes your body to release endorphins where the pain is located. Endorphins are your body's natural painkillers. They block the communication of pain signals to your brain. With the TENS unit set at normal mode with pulse width at 150 milliseconds and pulse rate at 10 hertz, it feels like the stimulation is on burst mode. I just wanted to describe the sensation from my perspective. With TENS unit, there are typically 3 modes: normal, burst, and modulation. The normal mode provides that constant stimulation current, and it's the most basic setting. Most first-time users use that mode. Burst mode is generally used for chronic pain. Modulation mode is for both acute and chronic pain. It's basically the random mode, and the cycle is between different frequencies. The general recommendation duration for using the electrical devices for acute pain is 20 to 60 minutes up to 4 times a day. For chronic pain, it's between 20 to 30 minutes up to 5 times a week. In the 4th edition book of therapeutic modalities in rehabilitation, it's stated that the nerve and muscle stimulating currents are capable of modulating pain through stimulation of cutaneous sensory nerves at high frequencies, producing muscle contraction and relaxation depending on the type of current and frequency, facilitating soft tissue and bone healing through the use of subsensory microcurrents, low-intensity stimulators, and producing a net movement of ions through the use of continuous direct current and thus stimulating a chemical change in the tissue. The change in pain perception through electrical stimulation is understood by the gate control theory, the descending control theory, and the endogenous opiate pain control theory, and the theoretical basis for pain reduction phenomena. Selecting the appropriate treatment parameter is critical if the desired tissue response is to be attained. In the Wongu clinic, I believe they use the ITO ES130 3-channel electrostim unit. It is also an asymmetric biphasic wave current device. Their pulse width is 100 microseconds. It has 3 levels of frequency: low ranging between 1 and 20, medium ranging from 20 to 150 hertz, and high ranging from 150 to 500 hertz. Their pulse mode is continuous, which is basically normal mode. So with that unit, it could be adjusted to low frequency of 10 hertz with a personal adjusted voltage preference for this purpose. The difference between the clinic device and my device is that the clinic device has an extra lead connector socket, so you can include 2 extra points. So for pain relief for chronic non-specific low back pain with electroacupuncture, I would use the 4 points, Yao Yan and UB23. So Yao Yan is actually about 3.5 inches lateral to the lower border of L4, these 2 points. And then the other 2 points I would use is bladder 23. It is about 1.5 inch lateral to the lower border of L2, so these 2 points. So this is the Yao Yan, and this is bladder 23. The Yao Yan is on the thoracolumbar fascia, the latissimus dorsi muscle, and the quadratus lumborum. Individually, the acupuncture point Yao Yan therapeutic action is to strengthen the kidney and benefit the lumbar region. For UB23 point, it's on the longissimus muscle, thoracolumbar fascia, iliocostalis muscle, quadratus lumborum, and also near the multifidus muscle. Individually, that point, therapeutic action is to tonify the kidney and fortify the yang, benefit the essence, nourish kidney yin, firm the kidney chi, benefit the ears and eyes, strengthen the lumbar spine. With each needle insertion, I will rotate it to provide a biophysical reaction. The electrical poles will clip longitudinally on the muscles, since electrical impulses on muscles are more effective in a longitudinal direction than a transverse direction. So the lead wires will clip on the same side bilaterally. With the 10-7000 set on normal mode with pulse width at 100 milliseconds and pulse rate at 10 hertz, about 20 to 30 minutes a day, 5 times a week, for 2 weeks, I believe it will evidently result in pain relief in the chronic non-specific low back pain. I hope all the information I provided backed this treatment method to execute its purpose in pain relief in non-specific chronic low back pain with electroacupuncture. Thank you.